Hello, I will be presenting hypertension today with Anta Long. As we know, blood pressure is an effect of the force the blood is putting on the vessels. Hypertension is known as the silent killer because it is often not noted until the patient already develops the damage caused by hypertension often leads to the major causes of death in America, including stroke and heart attack. The only way to protect yourself from finding out the hard way is to have your blood pressure checked by a medical professional. The risk factors for hypertension include ethnicity. Being of African American descent is the highest risk. Being a male over 45 or a female over 65. Having a sedentary lifestyle, obesity, or a family history also increase your risks. So for our case study, we're visiting patient X. He's a 47-year-old white male, 210 pounds, which puts him over the obese side for being 5'10". He has a sedentary desk job that is high stress, and his mother died recently of a heart attack. His meat is largely based on, or his diet is largely based on meat and starches. So one day, Mr. X is at the pharmacy. He decides to sit down and take his blood pressure while waiting for a script for his father. And the blood pressure machine shows that his blood pressure is highly elevated. When he goes to the pharmacist lets him know that he needs to go see a physician. While at the doctor's office, the labs come back. His blood pressure is shown as 185/80 with a pulse of 90. His LDL, HDL, and cholesterol are all elevated. Blood sugar is normal, and he is 36 pounds overweight for his height. The doctor tells him he needs to increase his physical activity and speak with a nutritionist, try to reduce stress, and orders him to see a cardiologist and starts him on a low dose of lisinopril. The nurse helps him to understand some of the things the doctor is telling him and that he needs to do. The walking will help him lose weight and increase the health of the heart. The body mass index that the doctor is using is a measurement to decide whether or not he is overweight for his height. And the labs that the physician drew are to help the doctor to understand the overall health of the patient's vasculature and also to understand the health of the patient's liver. So our questions for stage 1 is, how does the patient's lifestyle contribute to his risk factors? What about his lifestyle? The initial question is, how does the dietary risk factors contribute? What about his lifestyle contributes to the diagnosis? And what teaching can the nurse give about lisinopril? So his diet being high in meat and starch and low in fruits and veggies is going to be a major dietary contributor to his blood pressure. His sedentary lifestyle, age, and stress and family history also contribute. And the nurse should let him know that his blood pressure should be checked before administering the lisinopril to make sure that it's not too low. If the patient experiences any lightheadedness, dizziness, confusion, swelling of the tongue, lips, or throat, that he should discontinue use immediately and go to the nearest hospital. Now I will turn over the rest of the presentation to the lovely Miss Anta Long, and I appreciate you listening to me.
Hi, I'm Anta Long, and I'm going to do the rest of this presentation that Carrie has started. So Mr. X was 3 weeks later after he went to the doctor for this. Mr. X was in the yard working, and he started to feel a little tightness in his chest, dizzy, started feeling a little short of breath. Once he went inside and sat down, his symptoms started to go away. His wife insists that he goes to the emergency room because his mom just passed away from this, and so they admit him to run more tests on him. So when he was admitted, his assessment, his blood pressure was high, They ran an EKG, which was normal. His weight was 210. He wasn't short of breath. His oxygen level was 95%, and his chest X-ray was normal. So the lab values that came back showed that his troponin was slightly elevated. CK is normal. Triglycerides are a little elevated. His LDL a little elevated, and his HDL was not high enough. So according to the United States Health and Human Services, nursing intervention for this would we would triage the patient depending on his critical signs and symptoms. Of course, we would want to do a thorough history and make sure we get everything. MONA is something that we learned way back in nursing school. Morphine, oxygen, nitroglycerin, and aspirin. So we want to make sure that he gets those right away. We did cardiac labs on him, X-ray, and of course monitor while he's there. So the questions for stage 2 are, what is the diagnosis that would be for this patient? And so he's going to be admitted to the hospital, and so what other tests do you think that he will be performed on him when he is admitted? What medications will he likely be prescribed, and what education should he have? So the diagnosis is stable angina because it's stable because when he sits down and rests, then the symptoms go away. But if he's up, moving around, that exertion is what causes the symptoms to come. So he will have, when he's admitted, they will do an echocardiogram. They'll more than likely run a stress test on him, and it will progress to angioplasty, which is a balloon in the heart valve. So he'll probably be prescribed beta blockers, a statin for his cholesterol, anticoagulant. They'll probably have him taking an aspirin every day, and maybe give him nitroglycerin prescription to have so that he, if the symptoms do come back with the chest pain, then he'll have that to use. So So Mr. X will need to have education on heart disease, what it is, the risk factors, healthy diet, exercise. He'll need to lose weight, and any new medications that he is prescribed, he'll need to learn about that. So on to stage 3, after he is discharged from the hospital, him and his wife make an appointment to go see a nutritionist. And after their visit with the nutritionist, they decide to go home, develop a plan, and first thing they do is go through the kitchen and throw away everything that is unhealthy. And then they start to slowly integrate healthy foods into their diet daily. And they start a daily routine of walking around the block, and then they up the amount of time that they walk every day. And he also is staying compliant with his medications, and he has made an appointment with a cardiologist. So when he goes back to his doctor, his assessment is now his blood pressure is lower, 162/77, which is still the hypertension phase, but it's a lot better than it was. His weight, he has lost 25 pounds. His lab values are all in the normal level. He's been compliant with his medication. He has been eating a healthy diet, and he's been exercising every day. So according to the Human Health and Human Services again, he would need continued education, continued modification of his risk factors, follow up with his primary care doctor and the cardiologist, medical therapy as far as he'll need labs, and continued to watch his medications. and he'll need to be reinforced to make sure that he goes and sees a cardiologist.